we'll see about the imaging studies, right? Okay. So this is the introduction, what you have seen about the function, the types of these things and all. So today we'll see with imaging studies. So what do you mean by imaging studies? So imaging studies are nothing but we are going to take the images of the heart, like the morphology of the heart or anatomy of the heart, how the blood is flowing, what is how the person's heart is working, means the blood flow in the heart, in the chambers, and between the auricles and ventricles, and between the arteries and veins, between the chambers, and how the heart wall is looking, and what is thickness of the heart walls, and what is thickness of the auricles and ventricles. Is there any problem? Is there correct or not? And the rate of flow of blood flow from auricles to ventricles and ventricles to auricles, and all those things you'll see now, right? So in imaging studies, we have two things: chest rentgenogram and echocardiography. Your chest rentgenogram is nothing but chest radiography or chest X-ray, and echocardiography. So echocardiography is nothing but when we say echo, it means sound. So cardio means heart. Graphy means taking graph of it means. So with the help of your echocardiography, we are going to see the different functional activities and disorders of the heart by sending a sounds through the heart, and those sounds based upon the heart functioning and resistance of this heart, different tissues in the heart, some sound waves will reflect back. So based upon the reflection of the sound wave, we'll be having an image of the hearts, 2D and 3D images. So that's how we can do or perform echocardiography, right? So starting with your chest rentgenogram, chest this one, chest X-ray, chest radiography, chest rentgenogram. The first one. So these are the types, yeah. Chest rentgenogram or chest radiography. So chest rentgenography or chest radiography or chest X-ray are same. So what they will do is, when you have a patient, when patient came to you with initial presentations of heart failure or acute coronary syndrome, what you will do is, you will order, you will indicate a patient to go and perform a chest rentgenogram or chest X-ray or chest radiography. So with which we will be getting an image of the heart, X-ray of the heart, how the heart is, means the heart size is enlarged or reduced, what is the position of that, on all those things. So here, if you can see, there is a cardiac sellout or sellout. So what do you mean by cardiac sellout? So sellout, generally, if you see these two images, so sellout is nothing but a clear black, we cannot say clear, a black color image of a certain object in a white background, or white color image of the things in a black background. It can be either. It can be a black color image on white background or white color image on a black background. This is normal sellout. Or we can say a shadow of it, nothing but we can say in simple terms, a shadow of certain objects. Like take example, when you stand just behind the light and just side by the light. So what happens? So when the light passes through you, what are the rays which can pass through your body? So that will pass, we'll be having white color light. And what are the wherever the supposing when you have a light just beside you, what happens? If you keep a hand just beside if you are opposite to a light, what happens? So wherever your portions or areas where your hand is there, the light cannot pass through. So that you will be seeing as a black, right? So that is the sellout. And next one is cardiac sellout. So cardiac sellout is nothing but clearly see this image. So you are seeing certain white color things and black color areas and white color areas. This is how your cardiac sellout looks. So what they are going to say here is, wherever you are seeing this white color thing like the bones or the sternum, everything, so that is hard. That is the sternum, the bones is there, and this is the heart, and this is your lungs, and here the lines here is your vertebrae, right? So what they are saying here is, this black color things are the areas between the ribs. So what does it means? So when you perform this chest radiography or chest angiogram or chest X-ray, so you will be passing through, the photons will pass through the person. The photons will pass through the person. So based upon that photons which will pass through the person, some photons will pass through him, some photons or the light will absorb, and some photons will be reflected. Based upon that, there will be the detector. Based upon that, the detector will be catching the images and will reflect with the help of electromagnetic waves and electromagnetic images, right? So whatever this black color areas, whatever you're seeing here, these areas, they don't have dense material, means thick material to stop the photons, right? So what are parts here? This part we have lungs in this side, right? So that's why lungs don't have that much resistance to block the light, right? So because of which the photons are passing through and it's reaching the detector to have a electromagnetic imaging. But when you see here, when you see these parts, these are the bones, right? That's why when the light cannot pass through, you will be having a white shadows. When the light can pass through the object, you will be having a black background. When the light cannot pass through the object, you will be having a white color background. So if you can see here, this portion, as you have a heart here, you have sternum is there, heart is there, vertebra is there. That's why you're having somewhat milkish white color. So we'll be discussing in detail in upcoming slides about this. So that is a cardiac sellout, and this is what a sellout generally looks, right? So on your chest radiograph is a standard procedure for a patient to find out with heart failure. If a person is having a heart failure, that's one of the standard thing what you can go for preliminary analysis is with the help of your chest X-ray or chest radiograph, right? So with the help of this chest X-ray, what you can do? So with the help of this chest X-ray, you can find out there is an increase in heart or not, right? So and generally, if I didn't mean, see, even though the person don't have the cardiomegaly, still the patient might be having heart failure, right? But in here, if patient is having a cardiomegaly along with the heart failure in chest X-ray, there is a high morbidity and mortality rate for the patient, right? So we'll see what are the findings when you perform this chest radiography or chest X-ray, chest angiogram. What are the things which we can find out with it? So with the help of chest X-ray, you can find out the cardiomegaly if there is enlargement of the heart. Next, you can find out vascular redistribution if there is a change in the vasculature of the myocardial or all those things. Next one, interstitial and alveolar edema. If there is edema found, you'll be seeing it. But we'll be looking at here how we are going to find out edema and all those things. We'll discuss in upcoming slides. Next, peribronchial coughing you'll be seeing, and pleural effusion. So with the help of chest X-ray, you'll be seeing all these characters, right? So if you want to know with the help of chest X-ray, we can see all these 5 characters or more than these 5 characters. First, we have to know how can we read a X-ray and what are the different positions when we are taking an X-ray, right? And based on what positions, how the chest X-ray will appear. So we have to know about these 3 conditions before going to read about your chest echocardiogram, so chest radiography or chest angiogram or chest X-ray. So in here, if you see this image clearly, we have AP and PA. AP means anterior posterior view, and PA means posterior anterior view. If you can see these lines here, so in this thing, the photons or the light is passing through the person, and the backside you are having this chest X-ray. Consider this one, the chest X-ray as a detector, right? So when the images are passing from the anterior front portion of the human body. So from front portion means you'll be having chest and all these things through the lungs, right? So this is anterior posterior view. And this one, if the photons are falling or passing through starting from the back of the person, right, from the back side, that is posterior anterior view. So you just have to remember AP means anterior posterior and PA means posterior anterior. So why I'm saying this one is, when you take a X-ray, when you perform an image, when you perform the X-ray with the help of anterior posterior position or posterior anterior position, there will be certain changes with which you have to identify, okay, this X-ray is of anterior posterior position and this X-ray is of posterior anterior position, right? In this thing, if you can see once again, the person is looking towards the detector. Sorry, the person is looking towards the X-ray machine, means through which the rays are passing. If you can see this PA view, here what's happening, the X-rays are falling from the, or penetrating from the back side of the person. It means the person is looking towards the detector. In AP view, the person looks towards the X-ray machine, and PA view, the person will look towards the detector, right? This is how your AP view and PA view looks. So why I'm saying this one is, we'll discuss in further classes, why I'm explaining detail about AP view and PA view. So this is example of a PA view, posterior anterior means from back side to front side, right? So this is how one of the old classical method of how your X-ray machine works was. So this one is a posterior anterior view, means where the length, where the X-rays with 72 inches different is passing from back side of the person, from back of the person to the film plate or to the detector. So generally when the films or these photons fall from or pass through the body's person, some photons or some X-rays, some rays will pass through the person, will pass through the person's body, and some photons or some X-rays will absorb by the body, means by the bones or by the tissues or those things, and some will reflect back, right? Based upon this absorption passing through the image or object and reflecting back from the image, reflecting back from the object, we'll be having a chest X-ray, right? And next one, see. So this is a standing position of it. If you see at the top one, anterior posterior sequence, the beams are entering from front surface, from front side of the patient's body. If you see this one, the X-rays are entering from back side of the patient's body, right? And if you see this one, when you see a X-ray, this is what are things what you have to quickly monitor, right? So what we are monitoring here is, so if you can see these blue color lines here, so these are the airways, right? And the green color lines, this green color portion will be your lungs, right? And this red color one is the part of your cardiac mediastinum, means the middle part, the heart and the middle, we call it as cardiac mediastinum because it is a part of sternum and your heart both. And next, these yellow colors are called as your dense bones, like your vertebrae. So that's why if you can see this one clearly, so in the vertebrae, you are seeing a light white color things, light white color appearance, right? So why you are seeing this light white color appearance means this vertebrae is having only limited resistance to the X-rays, because of which only little portion of beams are passing through it. Whereas if you see this black color things, like the structure or the outline of the lungs, the green color thing, what's happening here? The lungs are not bones; those are just a tissues, elastic tissues, where we'll be having alveoli to pass through, alveoli for exchange of gases, right? So as the lungs are not that much dense or don't have that resistance towards the light, we'll be having this black color areas here, right? So blue color things are airways, green color things are lungs, and red color part what you can see here is cardiac mediastinum, and this yellow color things are the bones, your vertebrae. This is how your chest, any of the chest X-ray will appear, and this is left side of the thing, and this is the right side of the thing. So now we'll see a video how it happens, right? So consider this one where a person is standing in front of a detector in a posterior anterior view. When you say posterior anterior view, means the X-rays is falling from back side to the front side. You will be having X-ray machine. From X-ray machine, the photons or the rays will pass through the person. So when you have a X-rays with certain wavelength passing through a patient or a male or female, any of the patient, so some X-rays will reflect, some will absorb, some will pass through. Based upon the electromagnetic, these X-rays fall on the detector. The detector will convert those signals into electromagnetic waves or electromagnetic images, and this is how your X-ray looks. This is example of posterior anterior images, right? And based upon the resistance of the body parts, different parts like tissues, bones, you will be seeing two things. One is black and one is white. Black color thing called as radiolucent, and white color things are called as radio opaque. Right? Radio opaque means dense materials which will appear with the white background. Right? So like density is a major thing which plays a role in any of the X-rays. So the denser the material, less amount of rays will pass, or there won't be any passing of the signals, any passing of the X-rays. So denser material like metal will be very white, and lighter the material like tissues will be dark, right? So we'll take another example here, and we will see a very dense object, take an iron rod or take a pillar. What happens when you pass the X-rays through it? It cannot reach the detector because this pillar or this iron rod is having certain density where it will obstacle, where it will stop the X-rays or the light. because of which you will be seeing a white color shades. So if you remember the X-ray, all the bones are in white color shades where the things cannot pass through. And the other thing, consider this X-ray is a person who is having a pacemakers, artificial pacemakers on the bone. If you see this thing here, the bones and the pacemakers where the light cannot pass through is appearing white, and other places where the light can pass through, like if you can say this part is looking like a black color, nothing but your this tissue don't have much resistance to block the thing. So now we will see, when you see X-rays, we can find out, or we can differentiate 4 regions from black color to white: black, gray, off-white, and white. So the black color regions are nothing but radiolucent, as we discussed. So where this kind of black color things will happen means where there is lungs. So as I said, lungs, like the tissue resistance of this lung tissue is not much, and there is a passage of there is exchange of air, because of which there will be black color things. And next one is gray color. Gray color will be finding in case of soft tissues. So in this X-ray, where we can find the soft tissue and fat means heart. So heart is a soft tissue, right? And there will be fat deposition also, because of which you'll be finding a gray and soft color thing here. And next one is half white. So half white is nothing but the bones. If you can see, the bones are the shoulder bones. So what's happening here, as it is not much dense, so limited amount of rays will be passing through him, and this is how your half white will be looking. Next one is radio opaque, means full white color, right? Metal pacemakers. If you can see these metals, pacemakers, what's happening here? As this metal cannot allow the light to pass through, it will be looking in a white color. So density is a major thing which plays role in X-ray. Next one is the thickness. So here, the thicker the object, the lesser amount of light will pass through, and it will be appearing like a black color thing, right? So now we'll take an example of this one, how it happens and what it is. Take example of a glass of juice, a glass of water. So when you keep a glass of water and you focus at an image, at an X-rays through the glass of water, the image what will appear is this one, the black color image, because the density is less here, the thickness is less here, right? And instead of one glass, if you can take 2 glasses, if you can take 2 glasses of juice or 2 glasses of wine, and you pass the X-rays through the glass, what happens here? As the thickness is more, you'll be having somewhat whitish color. So this one, there is a little resistance, so you're seeing black color image like the lungs, and this one you are seeing somewhat white color because of your shoulder bones, and this one the thickness is more here, because of which you are observing the white color. See, thicker the object, brighter and radio opaque, because we have used 3 glasses of juice here, and here we have passed the X-rays through only 1 glass of juice, because of which we are seeing a black color radiolucent image. So consider here, take a chest X-ray. So when you take a chest X-ray, first you have to see this one, the brighter thing, and more radio opaque. So when you compare to this part, why this part is somewhat whitish color and this part is not that much whitish color means, so in here you have the sternum, the skin, and the heart is there, and the chest, certain parts of lungs are also having here. So here you have 3 to 4 materials. So you have skin, fat, heart, blood vessels, and vertebrae where the light cannot pass through. Much light cannot pass through. That's why you're having a brighter image here. When you compare the image here, so what are the things you have here? Here you have just the lungs. Here you have skin, fat, and lungs. That's it. So that's why you're having a darker appearance in this pink color line. So more radiolucent, right? And apart from this 2 things, what next, right? Next one is exposure. So exposure means nothing but exposing a material to the light. So when you take example of this, so here we are taking a light, we are taking a glass of juice. Once again, we expose the glass of juice for through the light only shorter period, so just 1 second or 2 seconds, right? So when we expose to 1 second or 2 seconds, much light won't pass through it, because of which we will be having a white color thing, right? Shorter exposure, nothing but underexposed, so the light cannot pass through because of short wavelength or shorter period of time, you'll be having a white color thing, right? And in other case, what we can do is we'll take other glass of juice and we'll be exposing the glass to somewhat more time. So here, if you consider we have passed you use the light for 1 or 2 seconds, in here we use the light for 30 seconds. Instead of 1, we use 30 seconds. When you use 30 seconds, there is a more amount of time the light passing through the glass. And the third one is we are exposed the same glass again for more time, means maybe for 1 minute. So when you use the light for 1 minute, there is a light which is focusing on glass for maximum amount of time or more amount of time, because of which whatever portions the light can pass through, the light will pass through. The remaining portions the light cannot pass. You will be having a radiolucent, nothing but the black color or dark color images. See, long exposure, overexposed, medium exposure, and short exposure, right? So this is how we can just see this thing. And next thing what we will see is when you see this one, when you see a heart, when you see X-ray, how we have to see it. So when you see X-ray like this in posterior anterior view, first thing you have to see the size and position, right? What is the size of the heart and what is the position of the heart? In this video, we will see about size and position of the heart. Generally, when we say we will take a heart, we will be saying in the medial sternum, the heart will present in the medial part, more towards the left side. So like this, the cardiac shell out should be not longer than half of the size. Supposing if you take this one as a 1 meter, the thoracic thing, the heart should not be more than 50% of the thing. So this is the distance between the two ends of the thoracic cage, and the heart distance should not be more than 50% of this thing. It should be less than 50% of. This is in case of posterior anterior view. But when you change the X-ray to anterior posterior view, so what happens here? The heart size should not be more than 60%. So why there is a difference between this posterior anterior view and anterior posterior view means this is based upon how you have performed this chest X-ray, right? But here what's happening, the heart size is artifactually enlarged. Artifactually enlarged in the sense when you pass the images to the front portion, from the front side, the anterior posterior position, there are so many other things which might block the thing, which might block the X-rays to pass through the heart, right? So that's why what we call as there will be increase in heart position, because of which we'll have a 60% of increase we can consider. So these two things, if you see, it is a posterior anterior view, right? It is a posterior anterior view of the heart. So these things, if you can see this heart, it is enlarged heart, is like a balloon. So the enlarged heart we called as a cardiomegaly. So when are the things we can find a cardiomegaly or heart failure means, we have to come up with certain things. Just think, the patient is having pericardial effusion, means there is pericardial effusion or mediastinal masses, certain fat depositions, and prominent epicardial fat parts are present over the heart, right? In that condition, heart will look like this. Next, ventricular hypertrophy. So ventricular hypertrophy means the patient who is on long-standing hypertension, means patient is having hypertension for a long period of time, then you can have a ventricular hypertrophy, right? So the other thing, if you take X-ray on when the person is exhaling or inhaling, the size of the heart will vary. Supposing when you go to a person for X-ray, you'll be having normal breathing, inhalation, exhalation. So what happens in case of inhalation, exhalation? In expiration, what happens? You'll be releasing the gas, where you'll be releasing the oxygen to outside, where your cardiac surround will look much bigger. So why I'm saying much bigger means here thoracic cage or thoracic activity size is reducing, right? And this is when you see it is a normal anterior posterior film, means where you can see the posterior view, where you can see the anterior view of it. We have to identify the arteria, or we can have to identify the heart. And apart from this, this is AP view and this is PA view, right? And here this is a normal heart, and here you can see a round shaped heart with cardiomegaly, right? And if you see this one, as generally we have seen, the size of the heart should not be more than 50%. But in the previous case, what you have seen, the size of the heart is more than 50%. And again, you can see the white color calcium deposits, or you can see the valves here, right? The pacemaker and the valves and all those external wires and everything you can just see here. So when we use pacemakers for heart, if patient is having pacemaker problems, so we'll be using that one generally, right? So like that, right? And next one is you have to see the position of the heart. Generally, the heart will be positioned, 2/3 of the heart will be located towards the left side, and 1/3 of the heart will be located towards the right side of the person, right? Yeah, this is normal position. If you find any abnormalities like 2/3 and 1/3 this thing, then you can find there is a problem with the person. Rented cardiography, echocardiogram report, where we are sending sounds to the heart based upon the different chambers, and based upon the resistance, and based upon the different parts of the heart, the sound waves will reflect back. See, if you see here, we have the valves here, the open auricles or ventricles we have here, where the sound waves won't reflect immediately. Whereas we see the upper part of the heart, means the over or outer experience, there might be a chance of reflecting the sound waves immediately when compared to the valves and all those kind of things. So now we'll see in detail what are the types of echocardiographies and how it will be used. What are those things, right? Next one. So in X-ray, sorry, not X-ray, in chest cardiography, we are going to use the sounds. The sound will be transmitted. The sound will be transmitted through a transducer, right? This one is transducer, where we'll be using this one, right? We'll be using a sound transmitted to and through the heart, where your sound waves are transmitted to and through the heart. Based upon based upon the bouncing back of sounds, we'll be having a imaging of the heart and the imaging of the valves and how the external structure of the heart and all those things, right? So this is how it looks. Like you can see auricles, ventricles, and all those things, right? So next, like I said, based upon the resistance of different tissues, your sound waves will bounce back. So different tissues will be having a different resistance for transmitting the sounds, right? So this one we also called as in different terms like oil stick impedance, nothing but the resistance for transmitting the sound waves, right? So as we see here, there are three types of echocardiographs, like transthoracic echocardiography, Dopplerechocardiography, and transesophageal echocardiography. So transthoracic echocardiography. What is transthoracic echocardiography? In transthoracic echocardiography, what happens? The patient will be see, the person who perform this one, what he will do? He will pass the sound waves through the person's heart with the help of a transducer positioned on the anterior chest direction, and we'll be having a image of it, right? So what happens here? The sound is reflected back in different frequencies, right? In different frequencies, the sound waves will come back. Based upon that, we'll be having a images. Based upon that, we'll be having a images in a electronic monitor or in a oscilloscope. Based upon the different frequencies, the sound will reflect back from heart to the detector, right? See, take example of this one. The computer will be attached with a wire with the help of a transducer. The transducer will send a signals to the heart. Based upon the resistance, certain sound waves with the different frequencies will hit back the transducer. Again, from transducer, there will be a connection to the computer where we will be seeing the image of the heart, right? Next, the first one is transthoracic echocardiography. Transthoracic means it measures, the transthoracic echocardiography will measure the cardiac hemodynamic inabilities and filling pressure. What is hemodynamics? Hemodynamics means blood. So hemodynamics means the blood flow in the heart. The blood flow in the heart. So apart from that, so what are the other things you can find out with transthoracic echocardiography? Means the valve motion abnormalities. When if there is a problem with the valves like tricuspid valves or bicuspid valves, you can find this one. Next one, the level of functioning capacity of the heart, means how much functioning of the heart is remaining, right? Next, post-infarct ventricular septal defects. If there is any chest wall defects or septal defects, we can find out. Next, we can find the presence of ventricular thrombi. If there is any blockage or if there is any blood coagulation or blood clot in ventricles, we can find out with the help of transthoracic echocardiography. And next one here is, so as we said, apart from imaging studies, we have some other stress-induced tests also. So for those things, this transthoracic echocardiography can be used along with exercise and pharmacological stress testing. So because of which, what they found out is they will be finding your heart position or your heart structure and feeling hemodynamics, everything. When the person is at with normal position, when he's taking rest, and after exercise or after certain stress, how the person's heart or valves will work, right? So like same thing, see, valve motion abnormalities associated with ischemia. So when you do certain exercise, you need more amount of oxygen. When there is a problem with the heart cannot pump the blood, due to which heart cannot supply more amount of oxygen to different parts, right? That is your ischemia. So the patient with IHD, we cannot detect if patient is having IHD with the help of TTE. What is IHD? Ischemic heart disease. So yeah, we can detect the patient with IH. We can detect the patient who is having this one, ischemic heart disease, right? And next one is so at present in clinical expertise, so transthoracic echocardiography is one of the major things which has been accepted and utilized for evaluation of systolic and diastolic cardiac functions. Is it clear? So next one is left ventricular ejection fraction. So what do you think by this term, left ventricular ejection fraction? So left ventricular ejection fraction, LVEF, means the fraction of end diastolic volume ejected from the left ventricle. So at the end of the diastolic pressure, how much amount is ejected? Generally, the normal range of left ventricular ejection fraction is 55 to 75%. At the same time, the patient might be having the left ventricular ejection fraction in this range, but still the patient might be having the heart failure because of diastolic ventricular dysfunction again, right? So next one is 2D. So what we are discussing all these things about your echocardiography, 2D echocardiography. Your 2D echocardiography will be helpful in providing a cross-sectional multiple image of the heart, with which you can find out the exact heart position and all. Next one, with the help of 2D echocardiography, we can see the anatomical assessments and cardiac chambers, means the heart chambers and heart walls, how it is, how it looks. So another thing, for the better imaging, they can use the contrast agents also for better visualization of the heart parts. Next one is so we have seen about transthoracic echocardiography. Now it is about Doppler echocardiography. So Doppler echocardiography is nothing but, so where we are going to use sounds and frequency of ultrasound will be passed through the heart, right? So based upon the velocity and direction of blood. So with the Doppler echocardiography, we can see the actual blood flow in the heart. The actual blood flow in the heart means with which velocity and how much amount of blood is moving towards the auricles, moving towards the ventricles, moving in different blood vessels, along with wall motions, right? The principle with which the Doppler echocardiography works is bouncing back mechanism, bouncing back waves based upon the blood flow in different parts of the heart. Next one, with the help of this Doppler echocardiography, we can see the valvular and wall motion abnormalities. If there is any problem for the tricuspid wall, bicuspid wall, all this will be seen. Next one is transesophageal echocardiogram. So in transesophageal echocardiogram, what happens? A transducer will be attached to the endoscope, right? Those endoscope will be, the pipe like thing will be passed through your esophagus just near the heart, where with which we can find the posterior heart structure, weaving the arteries, cardiac valves, and aorta, right? So those two things, transthoracic echocardiography and Doppler echocardiography, they are not inserting anything into the body, this is the waves. And in transesophageal echocardiography, what's happening? The endoscopy attached with transducer is passing through the esophagus just near the heart, where we can view the posterior structure. So now we will see the video of it, right? Okay, before going to that, so with the help of this thing, we can find out atrial appendages, thrombi, valvular dysfunctions, and any cardiac masses and calcium depositions. And the other thing, like I said, transthoracic echocardiography will be used to find out the hemodynamical unstable patients. But if the transthoracic, with the help of transthoracic echocardiography, we cannot see the hemodynamic changes in the patient, then we can use this one, transesophageal echocardiography. So now we will see the types and video of it. Okay. So next one is speckle tracking and strain rate. So speckle tracking and strain rate means, speckle tracking means imaging. Like we have seen a cardiac cell out, and here we'll be having different color of images when you use 2D echocardiography. Next one is based upon, with the help of this speckle tracking and strain rate, it's one of the sophisticated and new technique which is in hospital they are using now, means for almost 10 to 15 years, with which we can find out precise quantitative myocardial functional assessment. See, this is how your speckle and strain rating will be done, and this is how you can have all these images, right? Next one, 3D echocardiography. So 3D echocardiography will be providing better and improved images of the heart when compared to 2D echocardiography. So with the help of 3D echocardiography, we can find out left ventricular functional assessment, cardiac defects, valvular abnormalities, and intraoperative and intracardiac catheter problems. All these 4 things can be checked with the help of your echocardiography.